Encouraging news in the fight in the pandemic. Some federal data showing new cases continuing to fall, dropping by nearly 25% over the past 2 weeks alone. And while the U.S. does appear to be turning the corner in this latest surge, health officials warn it's not time to let our guard down. Here's ABC's Morgan Norwood with the latest from Los Angeles.
With new cases falling across the country, the U.S. seemingly approaching a transition. The WHO saying we're nearing the end of the emergency phase in the pandemic. Health experts adding the virus will remain, but say we have what we need to live with it.
The virus isn't going away. We may see future surges. But I think the restrictions, the mandates, a lot of those are going to really start easing. And what that means is when we see future surges, we're going to have to deploy the tools we have, vaccines, tests, etc., to get through them.
For now, those tools are the first line of defense as America continues to push back against the Omicron surge. In Oakland, the variant driving up cases among children.
Last week, we saw by far the highest peak during the entire pandemic of kids admitted for COVID.
Meanwhile, scientists are continuing to track an Omicron subvariant called BA2, identified in 55 countries and 17 states in the U.S. Health officials say there's no evidence it causes more severe disease, but some researchers say it spreads quickly, and that could mean it's easier to catch. Medical experts underline that if you're sick with BA2, any of the COVID tests already available will still work to detect it.
People should not take from stealth that means we can't detect it. All of our PCR tests that we know of and antigen tests are just as able to detect BA2 as they are to detect Omicron.
And the CDC continues to stress the importance of a third shot, a booster. A new study finding they increase protection against hospitalization by about 15%, and for those with compromised immune systems, about 19%. Morgan Norwood, ABC News, Los Angeles.